Nobody really knows what's going to happen there. And what is known is that it's going to happen in January. And also in January is your fourth quarter estimated tax payment that's due, the due date of that January 15th. So there's a cash flow concern with MFP because of the reimbursement, the timing of that reimbursement, and just the whole new system really that's going to be in place. And then there's of course, the wholesale side, when those again, when are you going to get reimbursed? Is it going to be fast enough where you can pay your wholesaler and, not have to float that? But then you got also on top of that is you got this January 15th estimate if you are in that position where you have to make that. Going into the planning this year, you definitely need to start now and start looking at, you know, how the MFP is going to impact you, whether you're going to do it or not. I believe most pharmacies will end up doing it. But right now, it's pretty clear that, you need to be preparing for some cash flow unknowns, 30, 60 days of cash flow to be prepared for that. So that's going to need to start right now. That planning needs to start right now. And if you're just now doing your tax returns for 915 and 1015, I mean, you're still back in 2024. We're looking at 2026 here. You got a couple months to flip the script real quick, and then not even that to get 2025 dialed in and where you're going to be tax wise, how that's going to impact you, what next year is going to look like with the MFP. There's a lot to do, especially if you're in that camp where you're on extension because the accounting's not up to date and things like that. So it's going to be, it's going to be a busy jump for those who are just kind of finishing up their tax returns.